This is one of the most important topic in your as a medical student. After passing your exam, when you started practicing, it will also help you. Okay. So, clinical enzymology, this can be used in 3 categories. Okay. First one is diagnostic uses of enzyme. Next is therapeutic uses of enzyme, and next one is to use in laboratory as enzyme. Okay. This is 3 broad category. Just remember this. First one is diagnosis, because some enzyme we can use as diagnostic marker. Okay. I am talking later. So today's learning objectives: diagnostic uses of enzyme, to use the diagnosis of diseases. Some diseases we use this enzymatic marker diagnosis, and also that to monitor the disease, how the patient is going on through the disease, to see the prognosis of the disease. Okay. Next is to use some enzyme as therapeutic, as a drug, like medicine, to treat some diseases. And in some laboratory investigations, we use as enzyme. Okay. So after completing the class, you can able to understand how to diagnose the disease with enzyme, to use enzyme as a therapeutic marker, to use as a enzyme as therapeutic agent, and use the enzyme as analysis in laboratory reagent. So enzyme, we can categorize enzyme in 2 types. One is plasma functional enzyme, one plasma non-functional enzyme. What is plasma functional enzymes? These enzymes present in plasma every time, each time. Okay. This enzyme is circulate with the blood, and they have some unique activities. Okay. Like example, coagulation factors. Okay. These are actually circulate in the blood as they are non-active form. When they activated, they start into action. Like if a vascular injury occurs, say damage in blood vessel, then blood start coagulation to prevent the blood loss. Then they get activated. Okay. Next, some enzymes like complement protein, they circulate in the blood, also present in the tissue. Some complement proteins are proenzymes, like complement C2, C3, C4, C5. Remember, not C6, C7, C8, C9. Okay. These are actually proenzymes. When they activated, then some cascade of chain reaction occurs. You will be teaching in your immunology lecture classes. Complement system, there is 2 pathway: intensive pathway, extensive pathway, and lectin pathway of activation complement. Just remember, so these proteins, coagulation factors, complement proteins, lipoprotein lipase, they are present in the blood. And some enzyme which are tissue specific, when the tissue or organ damaged, then they are marker raised in the blood. Okay. Normally present in extremely low concentration in plasma as compared with their high concentration in various tissue. These are actually non-plasma enzyme. In case of tissue damage, these are released in greater amount in causing higher plasma level. This lead to significance in diagnosis and sometimes prognostic significance. This is the importance of non-plasma enzyme. This includes enzyme present in exocrine secretions like pancreas. Pancreas has 2 glands, One is exocrine pancreas, one is endocrine pancreas. Okay? Exocrine pancreas is secrete amylase lipase, and endocrine pancreas secrete what? Anyone? Any idea? Endocrine pancreas secrete? Endocrine pancreas secrete insulin, glucagon, somatostatin. You heard the name? Pancreatic beta cell secrete insulin, alpha cell glucagon, delta cell somatostatin. Okay, you will be learning in your endocrine classes and physiology in details. Okay. So in case of acute pancreatitis, the pancreatic enzyme released in the blood circulation. Then we use this marker for diagnosing acute pancreatitis. Then enzyme is to predict pathological disorder of the various organs of the body like myocardial infection or hepatitis, prostatitis, prostatic cancer, etc. Next. So before going there, we have to know something about isoenzyme. Any idea isoenzyme? No separate in isoenzyme? Isoenzyme? Okay, just a brief I am telling you. Isoenzymes are also enzyme, but their functionality is same, but structurally they are little bit different from each other. They show some properties like they are different migration in electrophoretic field. Electrophoresis. You class complete? Electrophoresis? Okay. What is electrophoresis? Anyone? Any idea? Just shortly tell me. Brief. Electrophoresis. This is a technique. Okay. Electrophoresis is a technique by which we can separate the molecule in the basis of their electrical charge, mass. Okay. Yes. By this technique we can separate protein, plasma protein, isoenzyme, DNA, etc. So isoenzyme has some properties. They are different in movement in electrophoretic field. They are little bit different in kinetic property. Anyone remember what is Michaelis-Menten equation? I have taken class. BI, initial reaction, is equal to बोलो very good, divided by ठीक है सर. Okay, so isoenzyme has difference in kinetic property. There is some little bit difference in amino acid sequence. Okay, and little bit different in amino acid composition. All isoenzymes are enzymes, but not enzyme. All enzymes are not isoenzyme. Remember this. Like LDH, creatine kinase, etc. LDH has got 5 type of isoenzyme. Creatine kinase has got 3 type of isoenzyme. ठीक है? So this is isoenzyme. Coming back in plasma enzyme. So as I told earlier, plasma functional enzymes. These are present in plasma, the specific in plasma. Most are synthesized from liver and released in the circulation in plasma. Example, coagulation factors. How many coagulation factors we have in your blood? You studied in class 12, no? You should answer. 13. Okay. Among them, factor 4 is ionized calcium ion. 2 types of pathway, extrinsic pathway and intrinsic pathway. These are secreted from liver. Next, complement factors. This is part of immunology. Factor 2, C2, C3, C4, C5. These are proenzyme. When they activated, they start their action. Then they become enzyme. Celluloplasmin. This is a inflammatory protein secreted from liver. It has beautiful action in our body. It stores, transport copper ion. Copper. Okay, I am telling you later. Next, lipoprotein lipase. This is the enzyme present in aorta, thoracic aorta, abdominal aorta. They present anchored in the aortic wall. Next, renin. Renin secreted from kidney, juxtaglomeralar apparatus, kidney. Function of renin to convert angiotensin. Okay. Cholinester is present in nerve ending. These are plasma protein. Plasma non-functional protein. They are non-specific, derived from cell of organ or tissue. Example: creatinine kinase, lactate dehydrogenase, AST, ALT, okay, alkaline phosphatase, etc. Next. So, when plasma non-functional enzyme get elevated in some disease condition or disease state like hypoxia or tissue damage or infection, then their level elevated because they release in circulation in greater amount. Understand? When there is excess synthesis because of some tumor or abnormal tissue, vigor exercise, what happens if you do excessive exercise? Your muscle gets damaged or tired. And next one is decreased renal clearance. Look at the diagram. In the left side, see, this is normal cell turnover. So, little bit amount always present in the blood because of normal cell turnover, cell death. But in case of lot of cell get damaged because of some insult like necrosis or hypoxia, then the level increase in the plasma. A unit enzyme activity measured as unit per liter. So, international unit per liter. Okay. So, we are going to discuss this one by one today. Cardiac disease like myocardial infarction, liver disease, biliary tract disease, muscle, pancreatic disease, prostate disease, bone disease. Like cardiac disease, this enzyme get elevated. CKMB, AST, LDH, etc. Liver injury, ALT, AST, alkaline phosphatase, gamma glutamate transferase. This enzyme raised in blood. Biliary tract obstruction, this kind of enzyme get elevated. Alkaline phosphatase, gamma glutamate transferase, and 5' nucleotidase. Okay. In muscle injury, CKMM part of creatinine kinase get elevated. Creatinine kinase has 3 types of isoenzyme. CKMM, which is muscle specific, CKBB, which is brain specific, and CKMB is heart specific. Carefully, very important. In case of myocardial injury, heart attack, acute myocardial injury, okay. Remember, acute myocardial injury is a medical emergency. Being a doctor, you have to learn it without any excuse. Because this is a medical emergency, because as you are a doctor, going to be a doctor, you have to learn it. There is no excuse. You have to know this topic. As a MBBS doctor, as a medical practitioner, you have to learn this. There are several classes or cases you will see in future when you go to clinic and hospital. You have to learn how to diagnose myocardial infarction, how to learn ECG interpretation to diagnosis myocardial infarction. Okay, to treat the patient. At least before referring the patient to higher center, you have to give first aid so that you can save patient's life. Because this is one of the most dangerous medical condition. If you do not diagnose, then you may lose the patient. Patient may die. Okay. Anyone tell me what is the symptom of heart attack or acute myocardial infarction? Chest pain. This is the one most important sign. Apart from that, patient may come with hemodynamic derangement like low blood pressure or maybe high blood pressure. You may see patient is suffering from intense sweating because of sympathetic overactivity. Okay. Some condition like inferior wall myocardial infarction, patient may mimic epigastric pain. Often I have seen some doctors, they cannot diagnose, they treat it as acute gastritis, and eventually patient may die because of wrong diagnosis. In case of epigastric pain, you have to rule out the inferior wall myocardial infarction. You have to see what the symptom of the patient like intense sweating, severe pain, restlessness. Patient feel that I am going to die. Okay. First of all, you do go for an ECG to see what the symptom come. In case of infection, you can see ST elevation. You will learn in medicine lecture classes to ECG, how to interpret ECG. Okay. So today's class we are dealing with some enzymatic markers seen in acute myocardial infarction. Okay. You see the markers creatine kinase. The CKMB part is raised. When it is come raised, this enzymatic marker you can divide two types. One is enzymatic marker, one is non-enzymatic marker in acute myocardial infarction. Okay. In enzymatic marker, you have to remember three enzymes, very important enzymes. One is CKMB, one is LDH, and another is AST, aspartate aminotransferase. Okay. Nowadays we are using CKMB in LDH. AST is not using nowadays. Okay. So CKMB detectable, early detectable hour is 3 to 6 hours, and this maximum value reaches in 18 to 24 hours and return normal after 36 to 48 hours. This is enzymatic marker. This is the earliest enzymatic marker come into blood. Okay. And if you see the non-enzymatic cardiac marker, you can see the myoglobin. Myoglobin is raised 1 to 2 hours of heart attack and it reaches maximum value 6 to 9 hours and return to normal after 1 day or 24 hours. This is non-enzymatic marker. Okay. Next, see AST. AST is actually non-specific marker, so it is not so important, but just you have to remember it because you have to pass your exam. AST is detectable level 24 to 36 hours and the maximum value reaches in 4 to 5 days. Okay. And is returned to normal after 6 to 8 days. And see LDH. LDH is 5 subunits, 5 isoenzymes. 5 isoenzymes. LDH1 is actually heart specific. Is detectable level first detect 6 to 12 hours and then maximum value reaches 24 to 48 hours. Okay, and return to normal after 7 to 12 days. This is the non-enzymatic marker. When I was working in AIMS, I see they are regularly using LDH marker. Because in AIMS they are doing research and some lot of activity going on, they do it regularly. But in our area, we are not using LDH marker. Okay. Next is seen non-enzymatic marker, cardiac marker. As I told earlier, myoglobin is the first detectable non-enzymatic marker in heart attack. Next one is troponin I. Trop I is actually using here. Even in GMC, I have seen they are doing prop eye in their clinical practice. The patient with intubation, when they get admitted, they have to do these steps, prop eye. Is detectable measure within 4 hours. We can see the place level of the top eye level, and maximum level reaches 14 to 24 hours, and return to normal is 7 to 10 days. Okay, this is also not specific, but till it is using very useful at any interval after heart attack. So use it. Prop eye. And drop T is actually heart specific. This is actually when cardiac damage occurs, drop T release in blood. Drop T is one of the most specific marker. Even in when you start practicing periphery, we can do it in a very short period of time. Just few drop of blood and then see that the level come. With a kit based test, we can do drop T test. Very useful test. But the problem is that you have to wait for at least 6 hours. Before that, the level may be negative, come negative. Okay. So, it is not earliest marker, but very useful marker. Maximum value reaches 28 to 48 hours and return to normal after 10 to 14 days. So, this chart is very important. You have to remember it. Everyone have to remember it. You can take a screenshot of this PPT. Do not talk, just listen. Okay. Next term is liver. Liver, we can divide it in two types: a marker of hepatocellular injury or cellular and cell injury, and marker of cholestasis. What is cholestasis? To blockage in common bile duct or intrahepatic duct, and then some marker may raised, like alkaline phosphatase. Okay. So, marker of cell injury, hepatocellular injury, we can divide two types: ALT or AGBT, or alanine transaminase, ALT, in short form ALT. Previously, it also called as AGPT. And aspartate aminotransferase, aspartate transaminase, or AST, previously told as AGOT. When the hepatocellular cell damage, these enzymes release in the blood, and level get very high. Okay. And marker of cholestasis, 3 enzymes, remember: alkaline phosphatase, gamma glutamine transferase GGT, and 5' nucleotidase. 5' nucleotidase. Okay. Let's come one by one. Alanine transaminase and aspartate transaminase. Here, site is from cytosol or cell cytoplasm, and aspartate transaminase from liver cell, heart, skeletal muscle, cytosol, and mitochondria. So, this is non-specific, but till level get raised in case of cell damage. Okay. AST. Normal reference range: ALT 5 to 40 unit per liter, but it is most controversial. Some test it is 20 to 40, some is 15 to 40, like this. First remember 5 to 40. Less than 40 is normal. Okay. And ALT, it is also 5 to 31. Just remember less than 40 is normal. Okay. In case of viral hepatitis, marker very high, ALT up 300 to 1000 units per liter, where AST level very high because of viral hepatitis or toxic hepatitis, like toxic damage of liver. Okay. Mild to moderate high, 50 to 100 unit, biliary obstruction and alcoholic hepatitis, mild to moderately increased. In case of AST, alcohol-hepatitis, chronic active hepatitis, active hepatic metastasis, level may increased. In non-hepatic conditions like myocardial infarction, AST level elevated, skeletal muscle injury, AST level elevated. In case of alcoholic liver disease, AST level elevated because AST is also secreted from mitochondria. Okay, both ALT and AST level are increased in liver disease, but ALT is more than AST. So you have to make a ratio. AST by ALT is normally less than 1.0. When see in a LFT report, you can see they are using ALT by AST ratio. Normally it is less than 1.0 AST by ALT. But when AST by ALT ratio more than 2, you can see in alcoholic hepatitis. Reason of this because of reduction in hepatic ALT, but AST level is increased because AST is mitochondrial come from mitochondria. Alcohol is actually mitochondrial toxic. Understand? Increase release of AST from mitochondria because of chronic alcoholism. Alkaline phosphatase. Alkaline phosphatase have got 1, 2, 3, 4, 5, 6 isoenzymes. In case of if we separate in electrophoresis. Okay. Alkaline phosphatase 1 is secreted from biliary canaliculi. Biliary epithelial cell of biliary canaliculi. Percent is present 10%, approximately 10%. It is increase in obstetric jaundice because bilirubin is a toxic thing. It irritates the cell of biliary canaliculi and cells secrete greater amount of alkaline phosphatase. This is the reason in case of obstruction in CBD, like in a stone, like in a tumor or any worm, when they enter into the CBD, eventually cholestasis occurs. The cholestasis, like CBD, stored in CBD, alkaline phosphatase level increased. Okay. Carcinoma head of pancreas. Have you heard the name? Carcinoma head of pancreas, you will be taught in surgery classes. When carcinoma head of pancreas occurs, in obstruct the bile flow in the duodenum. As a result, cholestasis occurs. Next, alpha 2. Alpha 2 is a heat labile. It released from hepatic cell. Liver. Just remember this. Heat labile secret from hepatic cell. It is approximately 25%. Remember, it increase in hepatic disease. Alpha 2 heat stable. It is placental origin. In case of pregnancy, if you do blood test, you can give, see high level of alkaline phosphatase. It is actually normal. Percentage 1% approximately. In pregnancy, its level may increase because placenta origin. Pre-beta fraction, it is actually from bone, secreted from bone. In case of bone disease, the level may increase. In some physiological condition, level may increase, like young children, like adolescence period, when bone activity, osteoblastic activity is high, the level may increase. Okay, and it is approximately 50%. Next is gamma part, secreted from intestinal cell, approximately 10% is present. In condition like IBD, like ulcerative colitis, the level may increase. Okay, alkaline phosphate is a non-specific marker, but till using, so you have to learn it, you have to know it. Next is leukocyte alkaline phosphatase. It is level decrease in causing myeloid leukemia, but increase in lymphoma. Okay. Please don't talk. This class is a little bit boring, but it's very important class. Okay. There is no excuse. You have to learn it. Each and every slide is very, very important. Okay, just listen and go through the textbook because a lot of questions may come from this class. Okay. Next, see normal range. Normal range is 30 to 115 unit per liter. Okay. Moderate increase, there is 2 to 3 times increase in case of hepatic disease like infective hepatitis, alcoholic hepatitis, and hepatocellular carcinoma. Very highly increased 10 to 12 times like extrahepatic obstruction, okay, obstructive jaundice, intrahepatic cholestasis, like some drugs like infective hepatitis, drug like chlorpromazine, virus infection like hepatitis, infective hepatitis B virus, C virus, okay, E virus, hepatitis C virus, B, C, very important. Okay. Have you heard IV drug abusers? IV drug abusers, the injecting drug addict. Sometimes they take one syringe with multiple person. By this way, they get infected with hepatitis B and C. Eventually, actually the drug don't cause their any harm. Just enjoy the drug. But because of infection, like hepatitis B, hepatitis C, apart from HIV, they may die because of fulminant hepatitis. I've seen lot of patients, IV drug user patients, now they are died because of hepatitis, fulminant hepatitis, hepatic failure. Okay. Because hepatitis, the level, you can see very high level of bilirubin. Okay. Apart from that, the enzyme marker also raised. This is a practical thing. You will be see when you start practice, you will see this kind of patients in your clinic in chamber. Okay. And drastically increased level we found in bone disease like Paget disease, rickets, osteomalacia, osteoblastoma, metastatic carcinoma of bone. Suddenly get increased because of metastasis. Alkaline phosphate level get increased. So this fraction, pre-beta fraction get increased. Okay. So, as a medical student, when you go to home, sometimes your neighbor may come, takes lot of report, they come to say, brother or sister, please see this report, can you tell me what is going on? Now you can interpret, no? Quite interesting, no? This is quite interesting, medical field. So you have to learn it. Every day, each time, you have to learn it. Otherwise, you can't remember. Okay. Next. Gamma glutamin transferase (GGT). It is seen in liver, kidney, and intestinal disease, a marker of obstructive liver disease. Gamma glutamin transferase. Reference is 5 to 40 units per liter. There is sensitive biomarker for recognition of alcoholic abuse. Sometimes you can see one report, everything normal, bilirubin normal, AGBT, AGOT little bit raised, say 50 or 60. Or you can see suddenly GT level very high. Then you can ask them, are you doing lot of party? You can ask them. Just ask my yes. Sometimes I do practice party. You understand, na? বুঝতে পারলে আমার কথা? বুঝতে পারো নি? ধরো তুমি তোমার বাড়িতে পাশে একটা ভদ্রলোক এসে তোমাকে এসে বলছে যে দেখো তো রিপোর্টটা কি আছে, সব রিপোর্ট নর্মাল আছে, তেমন দেখি ডিজিটি পেশেন্টটা বেশি আছে। তুমি বলে কি পার্টি করেন? You understand, na? Huh? By this way, you can tell me, are you taking lot of alcohol every day, regularly? Understand? So, in case of alcoholism, GGT level may raised, definitely raised. Okay? This is significantly increased in obstructive jaundice. In obstructive jaundice, most important marker, as I told earlier, what? Alkaline phosphatase. Apart from that, this level also may get increased. Next is 5' nuclear adenase. This is actually not routinely used, but is still using as tumor marker to explore the any cancer of liver. Okay. It is ectoenzyme present in cell membrane. Reference is 2 to 10 units per liter. Moderate increase in hepatitis, highly increase in biliary obstruction, more specific for obstructive liver disease. Okay. Next, how can you interpret ALT in GGT? Just see this, hepatic or biliary disease, GGT level elevated, ALT level mild to moderate level elevated. In case of biliary disease only, GGT elevated, ALT is highly elevated. In case of bone disease, GGT is normal, but ALP is elevated. Okay. In case of alcohol abuse, GGT is highly elevated, while alkaline phosphatase is normal. By this way, you can interpret. Okay. Next, enzyme profile of muscle disease. Just remember, creatinine kinase, CKMM part elevated, aspartate transaminase AST level increase in muscle disease. This is non-specific marker. And aldolase, this is the earliest enzyme to raise but not specific. Okay, enzyme profile in muscle disease, muscle injury. Anyone tell me muscle disease? Anyone? Just one name. Myasthenia gravis, actually it is not from muscle injury. It is neurotransmitter defect actually. Duchenne muscle dystrophy. Have you heard the name? Duchenne muscular dystrophy. Okay. Mayapathy, yes, Mayapathy. Duchenne muscular dystrophy. Affected child is very start from child age. Suddenly the child cannot walk properly. When they start walking, the child going aged, he start falling. He is unable to climb the stairs. This is the first sign. Duchenne muscular dystrophy. Diagnosis: muscle biopsy, not muscle this enzyme. This actually we can do it to suspect the disease. Diagnosis: muscle biopsy. Treatment: no treatment. Eventually the patient may die. Very bad disease. Okay, it will be hard if learn in pediatric classes. Duchenne muscular dystrophy. Okay, next. Enzyme profile in pancreatic disease, very important. Take everyone a screenshot or picture. Here we are using two enzymes, lipase and amylase. Lipase is not only secreted from pancreas but also, amylase not only secreted from pancreas but also secreted from parotid gland. Okay, so amylase has two source. One is parotid gland secretion, one is pancreatic secretion. Okay, amylase, the function is to hydrolyze starch, broken down starch into maltose. They attack the alpha 1 fold linkages of glucose bond. Okay, they activate by chloride and calcium ion, produced by pancreas P type and salivary gland S type, amylase. Normal reference is 50 to 120 unit per liter. In case of acute pancreatitis, the level drastically increase up to thousands, more than thousands you can find. Okay, peak between 5 to 12 hours after onset of attack, return to normal within 2 to 4 days after acute phase has subsided. Moderately increase in case of chronic pancreatitis, mumps, in case of mumps, and pancreatic duct obstruction. Okay, in case of lipase is more specific in pancreatitis marker disease. Okay, the function of lipase is to hydrolyze, triacylglycerol, monoacylglycerol to fatty acid. Okay, lipase is specific because it's secreted only from pancreas. Understand? Normal reference is 0.2 to 1.0 unit per liter. It drastically increase in acute pancreatitis. Persists for 7 to 14 days. Elevated longer than amylase. So by this way, you can do some serial test like 1 or 2 days interval to do pancreatic lipase amylase estimation. You can see the amylase get returned normal after 2 to 4 days, but lipase will remain high for several days. By this way, you can diagnose pancreatitis. Apart from that, pancreatitis, you can have lot of other investigations there like ultrasound, CT scan. Okay. So remember, acute pancreatitis, this is also a one medical as well as surgical emergency. If you do not treat patient 50% or more than 50% patient may die because of pancreatitis. This is one of the most dangerous disease, pancreatitis. Acute pancreatitis sometimes mimic acute myocardial infarction, especially inferior wall myocardial infarction mimic acute pancreatitis, severe pain. And as a pancreas is a retroperitoneal organ, so pancreatic patient feel pain radiating from anterior to posterior wall of abdomen. Okay, pancreatitis. In case of mumps, lipase level is normal. So lipase estimation is advantages of amylase, moderately increasing cancer pancreas and biliary disease. Okay. Enzyme profile in prostate disease. We are using acid phosphatase and PSA, prostate specific antigen. Acid phosphatase, this hydrolyzes phosphoric acid ester at pH between 4 to 6. This is enzyme. secreted by prostate cells, RBC, platelet and WBC. Prostate isoenzyme is inactivated by tartaric acid. Normal reference range 0 to 0.6 unit per liter. Increase in prostate cancer, in bone metastasis of prostate cancer, okay, and useful for follow-up or treatment of prostate cancer. Prostate specific phosphate, important tumor marker. Just remember this. Acid phosphatase. Okay, next one is prostate specific antigen. This is actually not enzyme. Rather, you can say tumor marker. It's secreted from prostate gland. There is a glycoprotein with mild protease activity. Okay, produced from secretory epithelium of prostate gland, normally secreted into seminal fluid. The function is to liquefaction of seminal coagulum. And this is very specific for prostate activity. PSA is a tumor marker, so it detects, stage and monitor treatment of prostate cancer. Okay. Apart from prostate cancer, the level may increase in prostatitis, that is infection of prostate gland. First aid increased. So be careful. PSA is better predictor than prostate specific prostate acid phosphatase for diagnosis of prostate cancer. This most specific PSA. Okay, it is used as nowadays we are using a scanning of prostate cancer. Okay, next cholinesterase. Cholinesterase is two types. One is acyl cholinesterase and this pseudocholinesterase. Acyl cholinesterase is present in nerve ending and RBC. Okay. Cholinesterase and RBC determine exposure in persons working with organophosphorus insecticide poisoning like parathion. It irreversibly inhibit cholinesterase in RBC. Pseudocholinesterase, there is type 2 cholinesterase, it is non-specific, hydrolyzed acyl cholinesterase. It is present in liver cells. Next, glucose-free phosphate dehydrogenase. There are about 600 types of G6PD there in the earth. Every individual has different type of G6PD. In case of G6 deficiency, RBC may destroyed. RBC required NADP to neutralize the free radical damage because RBC is always exposing oxygen. Oxygen here highly toxic. In case of G6PD deficiency, patients suffer hemolytic anemia. When we use some drug like primaquine, drastically patients come with hemolytic jaundice. Okay. Next, celluloplasmin. What is celluloplasmin? This is not actually enzyme. This is a protein, inflammatory protein secreted by liver. It is yellow. Okay, celluloplasmin. The level may increase in case of inflammation. Okay. Normal reference is 20 to 50 milligram. In case of hepatolenticular degeneration, like Wilson disease, you can see lower level of celluloplasmin. Okay. Wilson disease you will be read in medicine or pediatrics classes. Okay. Just remember the name Wilson's disease, hepatolenticular disease. Copper may accumulate in the lens, eye lenses. You can find KF ring, K is a pressure ring, KF ring, just remember KF ring. Okay. So enzymes as tubule marker. These are like bone alkaline phosphatase increase in bone level disease. Placental alkaline phosphatase raise in ovarian, lung and GIT. MLS in pancreatic disease. Creatine kinase prostate, lung, breast, lung, colon and ovarian cancer. LDH raised in liver, lymphoma, leukemia. DGT in liver. 5'-nucleotides in liver disease. Prostate, PSA, and again prostate acid phosphatase in prostate disease. Okay, these are tumor marker, no specific marker. Enzyme other body fluid like adenine deaminase is evidently using in to exclude the tubercular pleural effusion. We after doing pleural tap, the pleural fluid we send it for ADH level estimation. If the ADH level very high, we can say this patient is suffering from pleural effusion because of tuberculosis. Okay. Lactate dehydrogenase, malignant tumor, LDH in pleural acidic fluid, non-dietary as enzyme is not tissue specific. Therapeutic use enzyme, just take this picture. Streptokinase, it is useful for treatment of myocardial infarction. To do thrombolysis, clot lysis. RTPA, recombinant tissue prothrombin activator. This is useful in cardiovascular accident. CBA, in infraction type of CBA, you are nowadays using CBA. Asparagines in acute lymphocytic leukemia. This is actually enzyme, but also working as a drug. By using as a drug to treatment. Trypsin and lipase in pancreatic insufficiency. We are using nowadays as a drug. Alpha-1 antitrypsin deficiency cases, we are using alpha-1 antitrypsin and emphysema. And papain, it is present in papaya fruit. Okay, this anti-inflammatory agent also used as in meat preparation. Time is lagi, 5 minutes lagi. Analytical uses, enzyme uses in reagent like glucose oxidase, peroxidase in glucose estimation, cholesterol oxidase, peroxidase in cholesterol estimation, urease as urea estimation, uric acid as uric acid estimation, hexokinase and G6PD as creatine kinase estimation, lipase, glycerol kinase, glycerol phosphate dehydrogenase in tyrosine estimation, lactate dehydrogenase to lactate estimation, alcohol dehydrogenase in ethanol estimation, alkaline phosphatase, phosphate peroxidase, it's using in some technique like ELISA. This is an enzyme using as reagent. Okay, these are some enzymes using as genetic engineering like restriction endonucleases to use a gene transfer DNA fingerprinting. Take DNA polymerase in PCR. Industrial uses like renin in cheese preparation, glucose isomerase in production of high fructose syrup, alpha amylase in food industry they are using, and proteases in washing powder, detergent. Okay, so this class is a little bit boring but very important class. Okay, everyone should to go through these classes, one of the most important class. Okay, thank you.